Cardiac failure. Your heart normally pumps 5 liters blood per minute. Although the name sounds like your heart has stopped working, but heart failure simply means that your heart is not able to pump blood as well as it should. When your heart has less pumping power, that can damage your organs and fluid can collect in your lungs. Many medical conditions that damage the heart muscle can cause heart failure. Common conditions include coronary artery disease, heart attack, cardiomyopathy, heart issues present at birth, diabetes, high blood pressure, arrhythmia, which is abnormal heart rhythms, kidney diseases, obesity, medications, some drugs used to fight cancer, chemotherapy can lead to heart failure. Heart failure often develops after these conditions, which damage or weakens the heart. However, heart failure can also occur if the heart becomes too stiff. In heart failure, the main pumping chambers of the heart, the ventricles, may become stiff and not fill properly between the beats. In some people, the heart muscle may become damaged and weakened. The ventricles may stretch to the point that heart can't pump enough blood through the body. Over time, the heart can no longer keep up the typical demands placed on it to pump blood to the rest of the body. Complications of heart failure depend on the severity of heart disease, your overall health, and other factors such as your age. Possible complications can include kidney damage or failure, heart valve problems, heart rhythm problems, and liver damage. Prevention. The key to preventing heart failure is to reduce your risk factors. You can control or eliminate many of the risk factors for heart disease by making healthy lifestyle changes and by taking the medications prescribed by your doctors. Lifestyle changes you can make to help prevent heart failure include not smoking, controlling certain conditions such as high blood pressure and diabetes, staying physically active, eating healthy foods, maintaining a healthy weight, and reducing and managing stress. Heart failure signs and symptoms may include shortness of breath with activity or when lying down, fatigue and weakness, swelling in the legs, ankles, and feet, rapid or irregular heartbeat, reduced ability to exercise, persistent cough or wheezing with white or pink blood-tinged mucus, swelling of the belly area, abdomen, very rapid weight gain from fluid buildup, nausea and lack of appetite, difficulty concentrating or decreased alertness, chest pain if heart failure is caused by a heart attack. Thanks for watching. If you liked the video, give it a big thumbs up, share and subscribe to the Aimers YouTube channel.